or emergencies demand quick compatibility. Evolutionary studies suggest that AB is the youngest blood type, emerging only a few thousand years ago through the mixing of A and B populations. Its rarity makes it valuable to researchers studying genetic diversity, since it represents a blending of two distinct antigen systems into one. The same antigens that provide broad transfusion compatibility, however, are linked with trade-offs. Type A, B individuals show higher susceptibility to certain clotting and vascular conditions compared to O types. Still, carrying AB positive means belonging to one of the smallest global blood groups while possessing the widest transfusion safety net, an unusual evolutionary combination of scarcity and advantage. O negative. O negative is one of the most critical blood types in medicine, despite being carried by less than 7% of the global population. Its defining feature is the complete absence of A, B, and RhD antigens on the surface of red blood cells. Because of this, O negative can be transfused into anyone regardless of their blood type, making it the universal donor for red cell transfusions. In emergency rooms and disaster situations where there is no time for blood typing, O negative is the first choice, often saving lives when compatibility testing isn't possible. From an evolutionary standpoint, the scarcity of O negative highlights how unusual it is for individuals to lack all three major antigens. Its absence of markers lowers risks of dangerous immune reactions in transfusions, but it also comes with vulnerabilities. O types in general are more prone to severe cholera and norovirus infections due to the exposed H antigen, and without the RhD factor, O negative mothers must be closely monitored in pregnancy to prevent hemolytic disease of the newborn. Still, its unmatched medical utility makes O negative carriers disproportionately important to global blood supply, granting them an evolutionary legacy as silent protectors in every health system. A negative. A negative is one of the rarer blood types, present in less than 2% of the global population. Its red blood cells carry the A antigen but lack the RhD factor, which limits compatibility in transfusion. A negative individuals can safely receive blood from A negative and O negative donors only, making their donor pool relatively small. In clinical practice, this scarcity makes every donation of A negative blood especially valuable, as it may be the only safe option for patients with this type. From an evolutionary perspective, the A antigen has been associated with stronger immune defenses against certain bacterial infections, a possible advantage in ancient farming societies where crowded living increased disease exposure. However, the absence of the RhD factor adds a complication in pregnancy. If an A-negative mother carries an Rh-positive child, her immune system can produce antibodies that endanger the baby's red blood cells. Modern medicine controls this risk with preventive treatment, but in earlier eras it likely influenced survival and reproduction. The combination of rarity, immune strength, and reproductive challenges makes A-negative a blood type with both hidden protections and delicate vulnerabilities. B negative. B negative is one of the rarest blood types, found in only about 1% of the global population. It is defined by the presence of B antigens on red blood cells, but the absence of the RhD factor. Because of this configuration, B negative individuals can only safely receive blood from B negative or O negative donors, making their transfusion options very limited. In hospitals, this scarcity means that B negative donations are carefully managed and considered high priority for patients who rely on them. From an evolutionary perspective, type B likely spread unevenly across ancient populations, with higher concentrations in parts of Asia and lower concentrations in parts of Africa and Europe, representation in Europe and the Americas. The absence of the RhD factor further narrows its distribution, contributing to its extreme rarity today. Some studies suggest that B carriers may show altered responses to certain bacterial and viral infections compared to other groups, reflecting subtle evolutionary trade-offs in immunity. As a result, B-negative individuals stand out not only for their scarcity, but also for carrying one of the most selectively distributed antigen profiles in human history.